Assalamualaikum and a very good afternoon to all my fellow students. I am Teacher Suhada, here's your science teacher. Okay, first of all, I warmly welcome all of you to the TAVIS intensive class. So for your information, we are going to cover all of the topic that you learned during Form 4 until Form 5 comprises of 21 topic within these 20 hours. Okay, within these 10 days. So please bear with me. Okay, the lesson one, I already covered the topic one until topic three. Yesterday, I did cover topic four until topic five, which is the mitosis and the meiosis chapter. Okay, so today I'm going to cover a topic from chapter 6 and a topic from chapter 7. In chapter 6, we're going to learn about the support system of the animals, human and the plants, the movement of animal, the movement of plant and the growth of human. Okay, and for unit 7 I'm going to cover about the body coordination system. How does our body coordinate to each other? Okay, so without further ado, I'm going to start with Unit 6. Okay, guys, we have a lot of animal in this world, right? So we are divide those animal into three categories. The first one, endoskeleton. Endo indicate inside the body, the skeleton inside the body. And the second one, we do have the exoskeleton. The skeleton is outside the body. Exo stand for outside. And the third one is hydrostatic skeleton. This animal don't have a skeleton. Then what they have, teacher? Okay, we go to the endoskeleton first. The examples of the endoskeleton animal is this fish, then we have a horse, rat, and snake. Okay, any animal that have the endoskeleton. Okay, it consists of the bone and the cartilage. Those animals have a bone and the cartilage inside their body, endoskeleton. Okay, the bones and the cartilage function to support their body. The bigger the animal, the bigger the bone will be. The bigger the skeleton will be. Okay. Another function to protect their organ. Like for a human, we do have a rib cage. What is the function for a rib cage? To protect our heart, to protect our lungs. Okay. And the skeleton and the cartilage also serve as a framework for muscle attachment. Okay, so we go to the exoskeleton. Exoskeleton, the example of animal, grasshopper. We have a crab over here. We have a prawn. We have a scorpion. Another example, centipede. Okay. This exoskeleton animal usually have a hard layer of chitin. They have the hard layer of chitin. Okay, chitin. This chitin properties is hard. The function of the chitin is to support the body weight. The function of the chitin, it have to support the body weight to the animal. It serves as the framework of muscle attachment. Okay, it also maintain the body shape of the animals. Okay, now we go to the hydrostatic skeleton. This hydrostatic animal doesn't have a skeleton. It consists of the muscular wall and the body cavity are occupied with a fluid. Okay. The function of the fluid to help them to maintain and control their body shape. It also aiding them in the movement. The example of the hydrostatic animal, we can see over here a worm, we can see a starfish. Another example, tapeworm. We also have a caterpillar. Usually for this type of animal, when we break down, we're gonna see a lot of fluids all over the body. Okay, for those three types of animal, it is divided into two categories. It's easy to remember. Okay, let me show you. For this endoskeleton animal, usually it is comprises of the vertebrate animal. What does it mean by vertebrate? When I mention vertebrate, that means that animal have a backbone. How about the invertebrate? While for this exoskeleton and hydrostatic skeleton, it is an invertebrate animal. Invertebrate don't have a backbone. Okay, now we go one by one into the exoskeleton size and the growth of exoskeleton animal. Okay, I take an example of grasshopper. How does the growth of the grasshopper will be? The growth of the grasshopper will show a graph of, this one is the steep shape graph. Okay, we call it step shape graph. Special for exoskeleton animal only. For a normal organism, usually we gonna have normal organism. We will have an S-shaped graph. Okay, sigmoid shaped graph. Okay. But for exoskeleton animals such as grasshopper, scorpion, it do have a step-shaped graph. Okay. Can you see at the point red over here? This red point indicate an ecdysis stage. Okay. And this 1, 2, 3, 4 until 5 indicate a neem stage. We call as a neem stage. Okay, what is ecdysis? Ecdysis is a process of a shedding skin of the animal. Shedding the skin of the animal equal to ecdysis. Shed skin. Okay, the vertical part of the growth graph, the vertical part over here, it's indicate the growth occur drastically. The size of the animal increase drastically. But for the horizontal part over here, indicate that there is zero growth of the animal. Zero growth of the animal. Teacher, why does the shape of the exoskeleton growth graph become a step shape? Because of the shedding skin process or ecdysis. I will explain further the ecdysis process after this. So now we go to the hydrostatic skeleton movement. The example of the hydrostatic skeleton movement, I will take example of a worm. Okay, the body of the worm comprises of two muscles. They have two muscles. The one that circle them, we call as a circular muscle, circular. And another muscle, horizontal part of the body. This horizontal part of the body we call longitudinal muscle. Okay, please remember these two. Longitudinal muscle, the circular muscle, and longitudinal muscle, the horizontal part of the muscle. Okay, so the movement of the worm are moved in form of antagonistic movement. Antagonistic movement. Okay, what does it mean by antagonistic movement? Antagonistic is a movement when the circular muscle relax, the longitudinal muscle have to be contract. They cannot just both of the muscle contract, both of the muscle relax. They cannot. When one of the muscle contract, another one must be relaxed. Okay, let's see. Number one, you can see the body of the worm become thinner and longer, slightly longer. So, and you can see the bristle, like this is not a bristle, this is a chitai. The chitai over here, chitai is a hard bristle surrounding the worm. Okay, the bristle over here is loose, it grip from the ground. Okay, the body of the worm become thinner and longer. The bristle or the chitae loosen the grip from the ground. Okay. What happened during this number one? Okay. During this number one, what happened? The circular muscle, what happened to the circular muscle? Circular muscle will contract while when circular muscle contract, what happened to the longitudinal muscle? Longitudinal muscle will relax. Okay. And what happened to number two is the vice versa. Number two, you can see that the structure of the worm body slightly become thicker. It's become thicker already, but it's become shortened. And you can see the chitae over here. This one, this structure we call a chitae. The chitae over here attached to the ground. The body become thickened and the chitae attached to the ground. Okay. During this time, the circular muscle is relaxed and the longitudinal muscles contract. You have to remember this kind of antagonistic movement of a worm. Okay, I repeat again. Okay, when the worm become thinner, become small, and become longer, elongate, the circular muscle contract. When the circular muscle contract, another muscle, longitudinal muscle, will relax. Okay, what happened? At the number two, when the body become thicker and the body become thicker and shorter, the circular muscle will relax, the longitudinal muscle will contract. Okay, I summarize all of the info over here in form of this diagram. Yeah. Okay, now let's go to the ecdysis. The reason why the graph of the exoskeleton animal become step up shape. Okay, why it's become a step up shape? Why, teacher? Why? I don't even know. Okay, the maximum ecdysis stage must be 5. Okay, the first stage is egg. This one, 2, 3, 4, 5. Until it's become mature, adult. Okay, this one egg and this one adult. Okay. The maximum stage for an exoskeleton animal is 5 stage of ecdysis. Okay, why this ecdysis? Why it's cause the growth shape become step up? Why? Okay, what happened? You see the diagram over here. This one is a cockroach shedding its skin. This one is the old skin. This one is the new skin. Okay, for this grasshopper, the old skin is slightly smaller, but the grasshopper become bigger already. What happened? Okay, the first thing, number one, what happened is the grasshopper or the exoskeleton animal suck in air. It suck in air that cause them to expand their body. When the body expand, the exoskeleton will break. Okay, after it suck air, it expand their body, then the whole exoskeleton will break. Okay, what happened number 3? After the exoskeleton break, after the whole exoskeleton break, a rapid growth of the grasshopper or exoskeleton animal will increase. A rapid growth will occur. It causes the size of the animal increase. You can see the size of the grasshopper here slightly bigger than its old skin, than its old exoskeleton. Okay, now it will become bigger until the new exoskeleton become hardened. Until new exoskeleton harden. Okay, then what gonna happen? After it's become hardened, the same process will repeat again. It will repeat again from number 1 until number 2, 3, and 4. Okay, the process will repeat again. The animal will suck the air so that the whole exoskeleton will break. Then the rapid growth will occur that cause the animal increase in term of size. Then the new exoskeleton harden. The stage repeating until a maximum of 5 stage of an ecdysis. Okay, over here indicate an ecdysis. Okay, now we're done with ecdysis and the growth of the exoskeleton animal. Let's go to the endoskeleton animal. For endoskeleton animal, we divide into three categories. The first one is terrestrial vertebrate. Terrestrial vertebrate, the vertebrate on the land. Okay, I give an example such as an elephant. In this diagram, elephant. I did talk that for this kind of vertebrate, the bigger the vertebrate, the bigger the animal, the bigger the skeleton would be. Okay, the bigger the body size of the animal, the larger the skeleton size. Okay. Okay, between cat small, right? Cat small. So when it's small, it has a small skeleton compared to an animal. Okay, what does support the weight of the animal? We know that the elephant is very large. Okay, the elephant is huge. The elephant is large. We can see that the pectoral girdle near to the head and the pelvic girdle near to the tail supporting their body weight. Okay, so please remember this fact. The larger the animal, the larger the skeleton, the endoskeleton of the terrestrial vertebrate. Okay, the body weight of the terrestrial vertebrate supported by the pelvic girdle and the pectoral girdle by these two, pelvic girdle and pectoral girdle. Okay, let's move to how about the aquatic vertebrates such as whale? Teacher, whale is very huge. Whale is huge. But how about the skeleton? For the whale, it's slightly different. It have a smaller endoskeleton. Whale have a smaller endoskeleton compared to any elephant. Elephant have a large endoskeleton to support its body weight. But why do the whale have a small endoskeleton? Because the body weight of the whale supported by the water buoyancy force. Okay, the body weight of the whale supported by the buoyancy force of the water. Okay, they also have the pectoral girdle, but their pectoral girdle are weak and small. Weak and small. For the elephant just now, the pectoral girdle, the bigger the animal, the larger the pectoral girdle and the pelvic girdle. But for aquatic vertebrates such as whale, it has a small and a weak pectoral girdle and a pelvic girdle. Remember those facts. Okay, this the third one. Another endoskeleton animal. How about birds, teacher? Does it have a big pectoral girdle or pelvic girdle? It doesn't have a pectoral girdle or pelvic girdle. It do have a sternum. This sternum over here is an adapting structure that enable it to fly. Okay, adapting structure to enable it to fly. Usually the sternum is flat and white. Flat and white. Adaptation structure so that the bird can fly. Okay, for the bird, it do have a hollow and a very light bone. Hollow bone and light bone. And the skull is slightly smaller compared to the aquatic vertebrate and the terrestrial vertebrate. Okay, it do have the light and a hollow bone. That's why it can fly. Okay, now we go to the human skeletal system. Okay, human skeletal system. What are the skeleton in our body? We have a lot of skeleton in our body, comprises from skull until the phalanx. We have a skull, clavicle, scapula, humerus, radius, ulna, and many more. How to memorize these, teacher? Okay, okay. To memorize this, usually for a paper one question, it always been asked about, okay, what is the axial skeleton? What is the appendicular skeleton? Okay, you have to remember that human skeletal system divide into two. We divide into two. The first one is axial skeleton. And the second one is the appendicular skeleton. Teacher, how can I know which one is axial skeleton and which one is the appendicular skeleton? Okay, now I give you a simple method to memorize any skeleton. We call this rule as the rule of 1 and 2. 1 for axial skeleton, 2 for appendicular skeleton. What is the rule of 1 and 2, teacher? Okay, for the rule of 1, any skeleton that we have only one. We have one skull. So, skull is the axial skeleton. We do have one rib cage. We have one rib cage. So, rib cage is the axial skeleton. We do have one vertebral column, right? One person, one vertebral column only. One person, one vertebral column. So, vertebral column is number 1, axial skeleton. What else? That we have only one. We do have a sternum. Sternum is over here. Sternum. One sternum indicate axial skeleton. Okay. The rule of 2. What is rule of 2? 2 stand for appendicular. Any bone that we have two, we have a pairs of bone, such as the pectoral girdle. Pectoral girdle, the one at our shoulders, the combination of the clavicle and scapula, we have two. On the right side, on the left side, we have two. So this one is an appendicular skeleton. Okay, what else we have two? Pelvic girdle. We have the right side and the left side pelvic girdle. We have two. That means it belongs to appendicular skeleton category. We also have two hands and two legs. So that two hands and all the bones at the hand and the legs are belong to the appendicular skeleton. Okay. So easy, the rule of 1 and 2. 1 for axial, 2 for appendicular skeleton. Alright. Any bone that only have one pair, don't have a pairs, only have one bone, that's belong to axial. That have a pairs of, that we have two bone or a pairs, that means that belong to appendicular skeleton. Okay, now, how to memorize? A tip, some tips to memorize hand bone and the leg bone. How to memorize it? I will give another acronym for today for this topic so that you can easily remember the structures of the human hand bone. Okay. Okay, let's number it first. 1, 2, 3, 4, 5, 6. We have 6. Hari Raya, you kena minta Ferrari. You don't minta duit raya, go minta Ferrari. Ya. Hari for humerus. Which one is humerus? This one is humerus. This upper bone of the hand is humerus. Okay. Then radius. Radius was the one at the external bone, the outer bone, radius, and ulna is over here. This one is ulna. And number 4, carpal, kena, carpal. Carpal is here, the width. Okay, number 4 and number 5, metacarpal, indicate a metacarpal, and phalanges is over here, phalanges or phalanx. Okay, now for hand bone, you please remember Hari Raya, you kena minta Ferrari. Humerus, radius, ulna, carpal, metacarpal, phalanx. Okay, so for the leg bone, for our feet, how we to remember for the feet? Okay, also the same, but another acronym, Ferhat tidak fikir terus minta Ferrari. We also have six, Ferhat. Ferhat representing femur. Femur is the longest bone in our body. Then we do have a tibia. Tibia inside here. And we have a fibula, the outer one. We do have a tarsal over here. Tarsal, please label a tarsal. After the tarsal, same goes to the human bone, to the hand bone. We do have a metatarsal. And last but not least, we do have a phalanx or phalanges. Okay, so please remember this acronym to memorize the structures of human bone. Comprises of Hari Raya, Yukuna Minta Ferrari, humerus, radius, ulna, carpal, metacarpal, phalanx. And for the feet bone, you have to remember Ferhat tidak fikir terus minta Ferrari. We do have a femur, tibia, fibula, tarsal, metatarsal, and phalanx. Okay, this is an acronym so that you can easily memorize the structures of hand and the feet bone. Okay, let's go to the next one. What else? The structures of the bone, we have two types of structure. Okay, masuk exam nanti mesti ingat Ferrari. Ya, please remember the Ferrari. Remember during Hari Raya, don't minta duit raya, please minta the Ferrari. Okay. Okay, now we go to the structures of the bone. We do have a compact bone and the hollow bone. Students, if you have any other question, you please just leave your question on our room chat so that I can pick a relevant question. Okay, we do have a compact bone and a hollow bone. Which one is the stronger? Which one is the lighter? Okay. Elephant do have a compact bone. It have a compact bone and a strong bone. Strong and compact bone to support its body weight. While for the bird don't have a compact bones. Hollow is lighter because got hollow. Yes, hollow is lighter. Okay. Why birds have a hollow bone? Because it need to fly, so it have to become lighter. It's lighter and it's strong. Okay. Okay. Let's see the structures of our bone. Let's say this is a tibia. Let's say this is our tibia. Our structures over here is comprises of a compact bone. It has a lot of calcium and phosphorus. But the middle structure, it is a hollow bone. We don't have a compact amount of calcium and phosphorus. Why we do have a hollow bone at the middle one? Because to prevent our bone breaking easily. Apart from hollow, it also has a thick wall. Okay. Now, let's see the stabilities, two factors that affecting the stability of an animal. The first one, center of gravity. Okay, this Q. Just imagine that this Q is a giraffe. And this P. Can you give me the animals that have low center of gravity? Anyone? What animal? Any animal that have a low center of gravity? Okay lah. Another one is crocodile. Yes, crocodile. I know. Okay, I say it's crocodile because it's shorter, right? Okay, imagine for the giraffe and the crocodile. Which animal? Mouse as well. Yes. Any animal that lower than the giraffe. Yeah. Okay. Now we take an example of a crocodile. We have a crocodile. We have a giraffe. Both of these animals want to drink the water. Which animal easy to drink the water? A giraffe or a crocodile? A giraffe or a crocodile? P or Q? Absolutely a Giraffe is not easy to drink a water. It's a crocodile. Okay, let's see the reason why after this. Okay, base area. Another factors with the base area. The larger the base area, the greater the stability. I give an example of R is a Ferrari. Just now we do have a Ferrari. And S is a motorcycle. Motorcycle or bicycle. Motorcycle only have two tires, while Ferrari have four tires and it is very short. So the base area for the Ferrari or a car is slightly greater than the motorcycle. So which one is stable? Ferrari or motorcycle? Anyone? Which one is the stable vehicle one? Ferrari or motorcycle? Oh, we keep talking about Ferrari today. Yeah, Ferrari, Husna, exactly. Why Ferrari? Because it has a greater base area. The greater the base area, the greater the stability. Okay, now let's see these four animal. Okay, just now I see that Kejuan told me that giraffe easy to drink the water. Is it easy? You can see it's easy or it's difficult. It have to spread its leg. It have to spread the leg to drinks the water. Why it spread the leg to drink the water? Because the giraffe want to lower the center of gravity so that it becomes stable, not easy to overturn, and also increases the base area. The greater the base area, the greater the stability. The lower the center of gravity, the greater the stability. Okay, please remember that. Okay, now we have a kangaroo. Kangaroo over here. Kangaroo only have 2 feet. 2 feet. How it can become stable? It stabilizes itself by using its tail. Let's put the tail on the ground as well to increase the base area, so that it's become more stable. How about the rhinoceros over here? What do you think about the rhinoceros? Why do the bigger animal have a short leg? Can you imagine a rhinoceros with a very long leg like a giraffe? To support their weight. No, it's not about to support the weight. Why the the rhinoceros having a short leg? Because to lower the center of gravity and to increase the base area. Can you imagine that the rhinoceros have a very long leg like a giraffe? It will be easily to fall, okay? So fine. Okay, how about this crocodile? Crocodile is the animal that have the shortest center of gravity. And you can see the leg of the animal, the leg of the crocodile, slightly outer. Okay, this is to increase the base area so that it's become more stable. Okay, correct, Ain. It's become more stable. Now, we are done about the animals. Let's go to the human. I need you guys to do some activity with me after this. But before that, let's learn about a joint, a human movement. How do we move our hands? How do we move our legs? Okay. Everything is all about science. Okay. When we talk about the movement, you have to remember joint. What is joint? We did learn this in a primary 6 or primary 5. What do you think the function of our joint? Joint? What is joint? Anyone have any idea what is joint? Okay, I don't see that anyone had any idea. Okay, to connect the bone. Yes, correct, Kejuan. Joint is a place of meeting two bones or more. The meeting point of a bones. The meeting point two or more bones, yeah? This called joint. Okay. Can you show me where is the joint in our body? The attachment between two bone. Even in our finger, we do have a joint over here and over here. Our finger, we do have a joints. Our wrist as well. Everything have a joint where we can move. Okay, in a joint, what happened in a joint? We do have a bone. Yeah, knee also our joint, the example of our bone. Okay, at the end of our bone, this is a cartilage. The function of cartilage, it serves as a cushion to reduce the friction, of those two bones. Okay, at the middle of it, we have a synovial fluid. The function of the synovial fluids to as a lubricant in our joint so that we can reduce the friction, the pressure. Okay, how about tendon? Tendon. Tendon is a place where your muscle connected with the bone. Okay. So when we talk about joint, please remember that it is a place of meeting two or more bones. And at our joint, we do have a cartilage. Cartilage to reduce the friction for our bone. And then we do have a synovial fluid that act as a lubricant for our joint. And tendon. The tendon is the attachment for the muscle and the bone. Okay, now let's do some activities. Muscle. How do we move our hands? It involving a muscle. We have one bicep and one tricep. Which one is bicep? Which one is tricep? Bicep is the outer one and the inner one is the tricep. Okay, what happened when we move our hand? It do you still remember the warm movement that I teach just now? When the circular muscle relax, then the longitudinal muscle have to be contract. See, it is called a movement of antagonistic. Same goes to our muscle. When the tricep is contract, then the bicep will be relaxed. Okay, let's try do an activities bending our hand. We bend our hand together. Okay, bending our hand. The upper one is a bicep. Who have a Okay, bicep, the upper one is a bicep and the lower one, the inner one is a tricep. Okay, you feel your bicep now. Is it hard or soft? I can feel that my bicep is slightly harder than my tricep. So, the part that's slightly harder indicate that your bicep is contracting. So, the bicep is contract, the tricep slightly soft is relaxed. Okay, then when you straight your hand, you can feel that your bicep softer than the tricep. Indicate that the bicep is relaxed and the tricep is contract. Okay, anyone? Okay, do you understand about this? The movement of the hand, antagonistic movement. If you have any question, please let me know so that we can do the activities again. I repeat again the activities. We try to bend our hand. The harder part, I can feel that the biceps is slightly harder than my triceps. So bicep is contract and the tricep is relaxed. So for when we strain our hand, our arm, yes, I can now recognize that I have a bicep. Okay. Okay, I am good. You have to recognize that you have a bicep, but you have to know the antagonistic movement of your muscle as well. When you bend your hand, what happened? Bicep is contract and tricep is relaxed. Okay, please remember that, yeah? Okay, we are done with the movement. Now, let's go to the human growth pattern. When one relax, another one contract. Yes, that called antagonistic movement. Okay, let's go to the human growth pattern. How many stage do we have? We have one stage of infancy, 0 to 3 months old, 3 to 13 years old, called a childhood stage. Then adolescent stage, rapid growth is occur. Then the adulthood, 20 to 65, and 65 onward, old age stage. We have how many stage? One, infancy, childhood, adolescence, adulthood, and old age. Okay, during the infancy, rapid growth is occur, and during a childhood, slow growth is occur. Adolescent, rapid growth occurring. Adulthood, a minimal growth is occurring. During adulthood, let's say you only have a height of 157 centimeter. So it won't be increases a lot. It won't be suddenly become 160. Once you reach 20 and above, when your height is 157, then it will become 157. Okay, now let's see the differences between the male and the female growth graph. Okay, you can see at the infancy stage, so the height is fixed once we are 20. Yes, the height is fixed once we are 20. It can be increases, but not a lot, plus minus 1 or 2 cm. Okay, clear? Now, let's go to the differences between the male and the female growth graph. We take example of the height of the male and the female. At the infancy stage, 0 until 4 years old, what happened? The growth of the male and the female is the same, okay? For the male and female, male has the same growth as a female at the age of 0 to 4 years old. First thing, okay. The second one, if the age reaching, let me underline first, 4 to 11 years old. 4 to 12, I think this one. 4 to 12 years old. What happened? 4 to 12. The male's taller than the female. Yes, the males. The male grows rapidly compared to the female by this time. Okay. What happened during 12 to 16 years old? Let's see what happened during 12 to 16 years old. The growth of the female greater than the male. Okay, last but not least, number 4. When the age 16 to 18, what happened? You can see that the male winning again. The male have a greater growth compared to a female. Okay. I repeat again, at the age of infancy, baby, 0 to 4 years old, the male growth and the female growth are the same. While at the age of 4 until 12 years old, the rate of growth of a male greater than a female. Okay, at the age of 12 until 16, the female winning, the rate of growth of the female greater than the male. And lastly, the male are winning again at the age of 16 and 18. The male have a greater rate of growth compared to women. Okay, now let's talk about plant. We are done to talk about animal. We are done talk about human. Now we are going to talk about a plants. Okay, the support system in a plant, the growth in a plant. We divide the plants into two categories. The first one is terrestrial plants and the second one aquatic plant. For the terrestrial plant, it do the one categories is do have a woody plants. It do have a woods. While the plant that don't have a wood, we call as a herbaceous plants. Okay, for a plant that have a wood, it have a hardy wood tissues with lignin. What make it hard? A lignin over here. Okay, what is the example of the woody plant? Can you guys give any example? Usually it's slightly bigger and taller. Is there any example of the woody plants, guys? I can give rambutan trees, durian trees. Okay, how about the herbaceous plant? The example of the herbaceous plant is fern. Okay, for the terrestrial plant, it do have the rose. Rose is a small plant. It don't have it have a woody plant, but the support is different. Yeah, Husna. Okay, the additional support for a woody plant, a buttress root. The diagram over here. We have a prop roots. As example, a maize. The prop root, the root are growing from the branches until the ground. Stud root for a mangrove root. This one, the example of the third root, a mangrove. Okay. How about for the herbaceous plant? Tendrils. The example of the plant is, can you give an example for a tendril? The plant that have a tendril support? Cucumber, pumpkin. Okay, how about the plant that have a clasping root? We can call as a duit plant or money plant, money plant or orchid. Orchids. Okay, the plant that have a hollow stem. That one is the additional support, yeah? Okay, now let's go to the, yes, watermelon also have a tendrils. Okay, let's go to the aquatic plants. It comprises of the non-woody tissues. It's supported by a buoyancy force and consists of the parenchyma tissues. Okay, let's see the diagram over here, down here at the bottom. This one. This is a structure that have an parenchyma tissues. In parenchyma tissues, there's a lot of air space, and this air space will make the plant float. Okay, now we are done for unit 6. Before we go to the answering and tips, I'm about to revise a little bit what we already learned. We have 3 types of animal, which is the endoskeleton, exoskeleton, hydrostatic skeleton. We do have discussed about the category of the endoskeleton animal. We have a terrestrial animal, vertebrate, such as elephant. We do have aquatic vertebrate that have slightly smaller pelvis and the pelvic girdle and the pectoral girdle. We do have a bird as an example. Bird have a hollow and a stronger compact bone. And a stronger, it don't have a compact bone. The bird have a sternum adaptation structure that enable the bird to fly. And we do learn about the human skeletal system, the law of 2 and 1. Any skeleton that we only have one, that belong to the axial skeleton, and any skeleton that we have in a group of pairs, such as feet or our shoulders, clavicle and scapula, that is belong to appendicular skeleton. We do learn about, what else do we learn? We learn about the stability of the animal. The larger the base area, the greater the stability. The lower the center of gravity, the greater the stability. Okay, now let's try to answer question from paper 1 by apply the GPS technique. G for garis, underline your keyword. P for potong, remove the incorrect answer. And selesai, finish and transfer your answer into a OMR paper. Okay, diagram 4 shows the cross section of an earthworm. Okay, we do learn about earthworm just now. Earthworm have a circular muscle and a longitudinal muscle. Circular was the one over here, and the longitudinal muscle was the horizontal one. Okay, let's see the question. What is the function of the ketai? What is the function of the ketai? The keyword over here is the ketai. This one is the ketai, ketai, ketai. Okay, what is the function of the bristle-like ketai? Is it for absorbing a food? Just now we do learn about the locomotions, not about the absorption of food. So this one is incorrect. Pangka, remove the answer. Supply a nutrient. How can you get a nutrient from that ketai, from that bristle-like thing? So it's also incorrect one. Okay, how about C? Use for excretion. We are not using that for excretion, right? So the correct answer will be locomotion. We learned when we talk about the longitudinal muscle and circular muscle. Please remember it's for a locomotion of a hydrostatic animal. Okay. Now let's go to the next question. Diagram 5 shows the structures of human arm. Okay guys, which one is a bicep and which one is the tricep? The inner one is a tricep. X for tricep. Transfer over here, tricep. Y for bicep. If X tricep, Y absolutely a bicep. Okay, let's read the question. How do the muscle X and Y act when the arm straighten? Okay. It's not bending your arm, yeah? Okay. When you bend your arm, you know that your bicep is contracting. So that is not the correct answer, right? Because it do ask about strengthening your leg, hand. Okay, so which one the incorrect one? The bicep not contracting. The one that have the contracting bicep, please remove. Okay, remove Pangka. Remove the answer. Now, the choices of answer between B and C. We know that the movement of the muscle must be antagonistic. When the bicep contract, then the tricep have to be relaxed. So you can see that the choice of answer B, both relax. Bicep relax, triceps also relax. So this is not the correct answer. The correct answer will be C, where the tricep contract and the bicep relax. Okay, next. Diagram 5 shows human growth curve based on a height. Okay. At which stage, A, B, C, and D, does the child reach puberty? At which stage? Usually at the teenager stage, no? A for a infancy stage. B for what? Childhood stage. And C for adolescent stage. Yeah, I can see that someone answering C. Adolescence, we are reaching Puberty when we are at adolescent. And D is what stage? Old age. So the correct answer is C, adolescence. Okay, let's have a look at the picture of a giraffe over here. Let's try to answer together. Which of the following caused the giraffe to be not stable? Why giraffe not stable? Why the giraffe not stable? The factors that affecting the stability of an animal, we have two. Base area and the center of gravity. Okay. Apart of that, besides that, we can consider it's the incorrect answer. Large body size. No, it's not. So you can pangkah this because it is an incorrect answer. So another incorrect answer, high body mass. Also not the correct answer. C, small base area. Okay, this one slightly confusing. Small base area and high center of gravity. Both is correct, but only one that have the... Okay, we can see the giraffe base area. The first thing when we see the giraffe, please remember the center of gravity because we know that giraffe is taller. Why someone is answering A? Has nothing to do to the stability of an animal. Okay, it's either the base area of center of gravity. When we talk about the giraffe, the animal, the taller animal, the correct answer will be the height because they have high center of gravity. Okay, so D is the correct answer, yeah, not A. Okay, now let's move to the next question. Okay, what type of the supportive root for this tree? This is a buttress root. Usually for large trees. Okay, let's see the question. Which of the following trees has this type of roots? A buttress root. Please remove the trees that don't have this kind of roots. Maize don't have. It has a prop roots. Sunflower also prop roots. It's either coconut trees and durian. Between coconut trees and durian, coconut trees has a prop root. Durian trees is the correct answer. It has a buttress root. Okay, try to apply the GPS technique on this jellyfish. How does this jellyfish support itself? How does it support itself in the movement? Okay, A. The jellyfish supported by hydrostatic skeleton with a fluid pressure in cavity to help the movement. It can be right. The jellyfish is a hydrostatic animal, right? Okay, so B. The jellyfish supported by the hard exoskeleton. It don't have an exoskeleton, teacher. So B is incorrect. So please remove pangkah. Okay, how about C? The jellyfish supported by the water pressure for the cell movement. It's not all about the pressure of the water. Also the incorrect one. So how about D? The jellyfish exert pressure on the wall by forming the exoskeleton. It doesn't have an exoskeleton. So the correct answer is A. Selesai. Now you only have to move your answer from the question paper to the OMR paper. Okay, now let's see what is the function of the cartilage. Just now we did talk about the joint where the location two or more bones being attached together. In a joint, we do have a cartilage and we do have a synovial fluid. We do have the tendon. Okay, what is the function of the cartilage? Anyone still remember? I see that someone answer A. Okay, let's see. To protect the bone. It can be right. Okay, let's see B. As a lubricant. As this one is the function for synovial fluid. Synovial fluid. Okay, so this one is incorrect. Remove. C. Connecting muscle to the bone. This one belong to tendons. Also not the correct answer. To reduce the frictional forces. Okay, it can be right. So we have the two answer that's slightly confusing. The correct answer for this function of the cartilage is the to reduce the frictional forces. You want to reduce the pressure, yeah, Kejuan? It okay. Now we move to the paper 2. Paper 2 comprises of the three sections, section A, section B, and section C. We go to the section A first, comprises of equation of science processing skill. You need to observe, you need to give hypothesis, you need to give inference. Okay, the first question. A student conducted an experiment to study the growth of green bean seedling. The student want to study the growth of green bean seedling. The height of the green bean seedling was measured for every 2 days. The table 2 shows the result of the experiment. Okay, time. Usually for this question, I did inform yesterday, please find the heart of the question. What is the heart of the question for section A? You need to find the manipulated variables MV. Then you have to find the responding variable. Okay, since this question provide you with the complete table, the left side always be a manipulated variable, while the right side always be a responding variable. So your manipulated variables is the time. Every 2 days, you take the measurement of the green bean seedling. Responding variables, the height of green bean seedling in cm. Okay, you can see that by day, the height of the green bean seedling increases. Okay, let's see the first question. What did it ask? By using the table 2, draw the graph of the height of the green bean seedling against time. Okay, refer this table. Now, let's try to draw the graph together. Okay, during 0 day, the height of the green bean seedling is 0. 0. During day 2, the height was 1 cm. Day 2, 1 cm. Okay, what about day 4? It's become 5 cm already. Day 4, it become 5 cm. Day 6, it's become 9 cm. And day 8, it is 11 cm. Day 8, 11 cm. And then day 10, 12 cm. Okay, now this one, if you transfer the information correctly, you're gonna get 1 mark. Another 1 mark, where can you get? For a line. You have to join the line between the point that you mark. Okay, let's make a graph. Join one. Okay, until here. Okay, let's make a nice curve. So this curve, another 1 mark. So the total mark utilized for this graph, you're gonna get 2 marks. Usually, for a question involving you to draw a graph, they already provide with the scale. Scale over here, it's provide. They provide the scale. They provide the x-axis. They provide the y-axis. Usually, another tips to get the heart of the question, to get the manipulated variables, to get the responding variables. The y-axis always be the responding variable. And the x-axis always be a manipulated variables. Okay, that is another tips that I give. Okay, now let's move to question B. Based on graph 2a, what is the relationship between the height of the green bean seedling with time? The relationship. Relationship is the hypothesis. What is the hypothesis? You can see from the graph that the height of the green bean seedling increases with time. 1 mark over here. You can see from the science question, you can get the answer from the question. Everything is there. Okay. Based on the experiment, state the operational definition for the growth of the seedling. Usually, students are scared to answer this kind of question. Operational definition. Why do you scared? I have another tips for you. Okay, if the question is asking you about the operational definition or operasi secara definisi, the one that you can do is you take the what they ask. They ask about the growth of the seedling. Okay. The keywords. This one is the keyword. Growth of the seedling. You plus with the responding variables. Okay. The growth of the green bean seedling is the, okay, this one is the keywords. The thing that they ask you. Okay. The height of the green bean seedling is the responding variables. Okay. Term. They ask you about the growth of the seedling. The term over here plus with responding variables. So easy. Then you already get 4 mark. Okay, last mark. Usually last mark is the application question. Diagram 1 shows the growth curve of animal with an outer skeleton. That's mean the exoskeleton. Exoskeleton animal could be grasshopper. In your opinion, why the graph in diagram 1 different from the drawn graph in 2A? 2A, we do have a sigmoid shaped graph. Why this graph belong to exoskeleton animal become a step-shaped graph? Why? Because of an ecdysis process. Ecdysis is a process that will happen until the animal become matured. Okay? The maximum is five stage of an ecdysis. Ecdysis same to shading skin. Okay, let's see the question from section B. Section B is all about the theory and application. Theory and application. This diagram shows a human growth rate pattern. Sigmoid shape, A for infancy, B for childhood, adolescence, D for adulthood, E for old age. Okay, what is the shape? The shape of the graph. Sigmoid shape. If you write sigmoid, 1 mark. S shape also you get another mark. Okay, Amira has a 70 years old grandmother. 70 years old belong to stage E. She find out that her grandmother hunchback starting to get visible based on diagram 7.1. At what stage the growth of Amira grandmother? You have to justify at what stage. If you write stage E, yes, 1 mark over here. And it do ask about explain why do you say that Amira's grandmother belong to stage E? Because due to the decreasing of height of the grandmother during the old age, the growth almost stop. Negative growth. Okay, no growth over here. Okay, next question. The growth pattern for male and female are differ. The graph in 7.2 shows the male and female curve graph. Male and female. The straight line graph is a male and the dotted line is a female. Based on the graph, give two comparison between the growth rates of male and female. This is a favorite question. Okay, you just justify. Let's say you talk about the childhood stage. At the childhood stage, the growth of male kid and the female kid are same. Just write like that. Oh, this one is not the childhood. This one is the infancy stage. Infancy stage. You can write Asim. Okay, while at the childhood stage, this one childhood stage, what happened? The growth as for a male greater than the growth of a female. Okay, what happened during this one? Teenagers stage. During the adolescent stage, the growth of the female greater than a male. Okay. Okay, guys, please don't draw. You can write a you please write a full sentence. Yeah, don't draw. This one just a notes for you. Okay. Diet is the amount of food intakes of everyday life. Balanced diet is very important. In your opinion, what is the effect of imbalanced diet to the rate of human growth? Someone, if they eat less, then they can be a stunted growth. If they eat more than a balanced diet, they can get an obesity. This is an application question, yeah? Okay, let's move to the essay question. Question 11, you have to answer this question, comprises of an essay question. You have 10 marks over here. The structures of the question is like this. They will ask about the problem statement first. You can get the problem statement from the paragraph, from the situation. You can get the hypothesis from the situation as well. Okay. During a science subject, the teacher stated that the bird bones were stronger than the elephant bones due to the hollow bones. While elephant bones were compact, the question is playing in Firdaus' mind. Does the hollow bone really stronger than the compact bone? Firdaus intend to run experiment to prove that hollow bone stronger than compact bone. You already can see the hypothesis over here. Hollow bone stronger than compact bone. Okay, let's try to answer the question A. Problem statement. How to tackle with this question? Problem statement, your answer must be in a question form, ended with question mark. How does it happen? Does the hollow bone stronger than the compact bone? Okay, 1 mark. Does the hollow bone stronger than the compact bone? It does. And ended of your answer will be a question mark. You ask yourself. Okay, the hypothesis. The hypothesis is here. Hollow bone stronger than compact bone. One hypothesis. Hypothesis is just making a comparison based on the statement, yeah? Okay. Question C. Question C. This one. Student have lots of students don't want to answer this question. I also not sure why. Maybe because you have to write the procedure. Okay, to write the procedure is very easy. I have a tips for you. Okay, hang on, yeah. Okay, basically they're gonna give the list of apparatus and the material that you need. Firdaus using A4 paper, cellophane tape, cardboard, scissors, and other materials. You can include another material. They will ask the aim of your experiment first. Why you want to do experiment? To prove that the hollow bone stronger than the compact bone, right? Okay. So, the aim of the experiment to study either the compact bone uh, greater than the to study either the hollow bone greater than the compact bone. Okay. How about the identification of variables? Okay. The hollow bones and the compact bone. MV, hollow bone, types of bone, and compact bone. How about the responding variable? Responding variable, the strength of the bone. Of bone, okay. Then the fixed variable, the one that you cannot change, the fixed variable, the mass of the bone, and diameter of the cylinder. Okay, procedure and method. How to get a full 4 mark for the procedures and okay, for this procedure, how to get a full mark, you can draw. You have an option to draw a diagram and to write your sentence, or you can use your full sentence. As for me, I like a student to draw a diagram. You draw a diagram, just draw a simple diagram, no need to shade the diagram, no need. This is not the art class, it is the science class. Please draw a simple diagram comprises of a hollow one. You are using a cylinder of the hollow cylinders, and another one is the compact cylinders. Okay, then you can just simply write, okay, the apparatus and the materials are set up as shown above. Why you want to write more? You already draw. Okay, second one, the textbook placed on the cardboard. You place a textbook on the cardboard until the cylinders become ruptures. Okay, until the cylinder falls down, until the whole thing falls down, the number of textbook can be accommodated until the paper roll bend in the table recorded. Okay, if you don't want to, you don't like to draw, you don't like to draw a diagram, you can use a full sentence, but you have to mention one by one. You have how you want to make the hollow cylinder, how, what is the diameters of the cylinder. Okay, how you have to set up the apparatus, you have to inform. Okay, you have to inform one by one. It is for a diagram, it's not a must, but it will ease you. You don't have to write a lot. Okay, then tabulation data. 1 mark for tabulation data. 1 mark only, not 4 mark. 4 marks for the procedures. Okay, you just make a simple tabulation data. MV, just now we do have the types of the bone. And this one, the number of textbook. Number of textbook can be whole. Okay, or the strength of the bone. Okay, this is such a quick tips. You can use a table. Please make a table so that you won't miss out any of the question. The first one always be the problem statement. The second one, hypothesis. The more the compact bone weaker than the hollow bone. Okay, write your answer over here. Aim. What is your aim of the experiment? To study either the compact bone stronger than the weaker than the hollow bone. Variables. What is the manipulated variables? Responding variables, constant variables, and procedure. Draw a diagram and a sentences to control your MV and RV. And last but not least, your tabulation data. On the left side is your manipulated variables, and the right side is a responding variable. Okay, guys, so we'll be continuing the next section after a 5-minute break. Yeah? Okay, see you after this. Okay, guys, let's continue with the section C. Section C comprises of the essay question 11, and question 12 and 13 is the choice. You can choose the question, either question 12 or question 13. Okay, now let's see the sample of the question 12 or 13. Ulia suffered a spinal cord injury as he fell while playing a football with his friend on the field. Okay, now Ulia suffering for spinal cord injuries. He need to get specialist treatment to deal with the problem. Okay. From the following 3 career areas, suggest the career path that Ulia should address. Who is that Ulia should meet to treat his injury? Now Ulia having a spinal cord injury, so who can he meet? A physiotherapist, chiropractor, or the orthopedic? Your answer should be based on the following aspect. They give you an aspect already, just make a table. The first one, they ask about the purpose of choosing, why you choosing. The explanation about the job scope, you explain a bit about the physiotherapy, what is a physiotherapist, what is chiropractor, what is orthopedic. Organize the expertise field according to priorities. organized according to priorities. Which one Ulia should meet first? It is either a chiropractor or a orthopedic or physiotherapist first. Okay, and then the fourth one, choose the most suitable. Okay, the total mark allocate here is 6 mark. Okay, let's see the sample of the answer. Okay, you can make a whole table so that you won't miss out. The first question, they ask about the purpose of choosing. Why do you choose for Ulia? You choose for Ulia to make the to choose the right area of expertise to treat the injury, Ulia's injury. Okay, so explanation for each career. Physiotherapist, what did physiotherapists do? Okay, what did they do? Physiotherapy mainly focus on the to help or restore the movement, recovery of the movement. Okay, chiropractor focus on the nerve injury, especially at the spine. Orthopedic basically it's focus on the systemic and skeletal injuries, including any injuries including a joint or tendons and muscle. Okay, so your selection order. Ulia can go to the chiropractor first because the chiropractor specialize for a spinal injury, orthopedic, followed by the orthopedic, last physiotherapist. Okay, choose the best choice. You have to choose the best choice and explain. Have to have the explanation. Chiropractor. Why? Because the specialty in treating nerve caused by spine injuries. Okay, because Ilya is having the spinal injury. Now, without further ado, let's go a bit to the body coordination. Okay, when we talk about the body coordination, please remember, bear in mind a human endocrine system. What is human endocrine system? Comprises of a gland. Our body have a gland which is comprises of the pituitary gland. Pituitary gland secreted what hormone? Growth hormone. Why? We name it a growth hormone. Of course, it's for stimulate the growth. Stimulate the growth. This hormone, every hormone, if it's excess, it's become a disease. Deficient also become a disease. Okay, excessive amount of the growth hormone or GH hormone, it will cause a gigantism. Usually notable in a form of height. Have you ever seen any person with the height over than 7 feet? Then the person probably have the excess GH hormone. Okay, the deficiency may cause the dwarfism. Okay, the short stature. The adult that have a height less than 147, 4 to 10 feet. Okay, the pituitary also releases the anti-diuretic hormone. The short form is ADH. This one, the short form GH. Okay. Control the amount of water absorbed by the kidney. It controls the amount of water that the kidney absorb. Okay. If we have a lot of ADH hormone secreted at our kidney, what happened? Then our kidney will absorb more water. So it will cause a problem that we always call as an edema. What happens if ADH insufficient? Deficiency in ADH. So less water reabsorb. That means more urine produced. Okay, have you heard of the disease of diabetes insipidus? It is one of the symptom is you keep pee a lot during nighttime or you keep over thirsty during nighttime. Why? This is happening because your body receive deficient amount of ADH. Deficient amount of ADH when a situation when a blood glucose level in our blood is too high. So a lot of urine will be produced. By this time, the ADH, so not deficient amount of ADH. Yeah? Okay. Then let's go to the thyroid gland. Endocrine gland, thyroid gland, it releases or secreted the thyroxine hormone. This thyroxine hormone control the metabolic rate. Teach you what is metabolic rate. When we eat something, the process of the food to become an energy. That is the metabolic reaction. Okay. So the excessive amount of thyroxine will cause a hypothyroidism. Have you heard of the Graves' disease? The person with a disease often have a palpitation, bulging eyes, irregular menstrualities. Okay, then the deficiency of thyroxine will cause the goiter, lackness of iodine. Okay, swelling at the neck area. Okay, the next endocrine gland, the next gland, pancreas, it releases insulin. Insulin to control the sugar level in our blood. Okay, let's say we have a lot of insulin in our body. Then all the sugar will be converted into the glucagon to be stored in the liver. So it will cause your body don't have enough low sugar level. This situation we call as a hypoglycemia. Have you experienced a situation where you didn't have time to eat in one whole day, and the end of the day you will feel slightly trembling? Okay, that is a situation where your body lack of sugar level. Okay, deficiency of the insulin. Let's say if your body don't have enough insulin, how come all of the sugar converted into the glucagon to be saved in the liver? So that's why it causes a diabetes mellitus, a lot of high sugar level in the body. Okay, ovary releases a hormone we call estrogen and progesterone. Estrogen to stimulate the production of ovum. Okay, estrogen also secreted uh, at the male. If the excessive amount of estrogen in a male, it will produce the female characteristic in male. Male can have a breast enlargement, any female characteristic. They can. Oh, okay, how about the deficiency of the estrogen? The deficiency of the estrogen will cause the female secondary sexual characteristic being affected. Let's say they won't be infertile, they will have infertile, they will have irregular menstrual. Okay, progesterone to maintain the thickness of uterus wall. Thickness of the uterus wall. Okay, the excessive amount of progesterone cause the lady to have irregular menstrual. Okay, while the deficiency of progesterone will cause the lady to delay the menstruation. Okay, testes. Testes secreted testosterone hormone. Testosterone hormone. Testosterone hormone is control the secondary sexual characteristic of a male. Okay, it stimulates the sperm production. Excessive amount of a testosterone, women also have a testosterone. It will cause a male characteristic in female. The female may have a small breast and any other male characteristic. Okay, deficiency amount of testosterone causes the low sperm counts. Okay, now let's go to the mechanism reaction of the hormone or endocrine system. Okay, how does endocrine system transfer to all around in our body? Okay, endocrine system act as a messenger to our whole body by using hormone. Hormone is a chemical structure. Hormone is a chemical structure that's secreted by our endocrine gland. Okay, just now we do have uh, give the example a pancreas. Pancreas, our endocrine gland, one of our endocrine gland. We have a pancreas over here. Pancreas secreted insulin. This one is an insulin. How does insulin being transferred in our body? By our blood circulatory system, by our blood vessel. Okay, then the insulin will go until it meet the target cell. The target cell has a specific receptor, specific shape to bind with the hormone. Okay, let's say insulin. Now, the shape of insulin is round, slightly round. Then it meet to a target cell. But this is not my target cell. The shape is different. So, I will keep walking until the hormone find the right target cell. So, the target cell for an insulin is a glucose. So, after the hormone made glucose, so it will bind, the insulin will bind with the glucose. The insulin won't bind with another target cell. It has a specific receptor. If the shape is round, then it will bind with the receptor that has a round shape. Okay. Now, let's go to the effects of drugs and alcohol. We categorize drug into 4 types, which is the inhalant, stimulant, depressant, and hallucinogen. Okay, each of these type of the drug cause different effect. Okay, let's see the inhalant. Inhalant usually being inhaled via breathing. It may cause a hallucination. Okay, the example: glue, paint thinner, gasoline. Okay, have you heard that the drug addict usually inhale or sniffing the glue? Then they become hallucinate in their own world. Okay, that is inhalant types of drug. Okay, the second one, stimulant. Stimulant, it speed up the impulse transfer. Speed up the impulse transmission. As an example, amphetamine, nicotine, caffeine. Okay. When you heard about stimulant, please remember about ADHD. A child with ADHD, attention deficit hyperactive disorder. Usually, the doctor will prescribe them with a stimulant so that they can focus more in the study. A child with ADHD, usually the dopamine level in their brain is not enough to make them focus on the study. But after the doctors, after they take the stimulant, the dopamine level in their brain, the dopamine level will increase. Therefore, they can focus more. Okay. When there is a stimulant, please remember the situation of ADHD. ADHD will call ADHD kids that eat the stimulant will undergo a decreasing amount of dopamine in their brain. That's why they can focus. Okay, depressant, slow down the impulse transmission. Okay, the example, morphine, heroin, barbiturate, and opium. Okay, this is depressant special to slow down the brain activity, the neurotransmitter activity. So that's the person that take the depressant will become slightly relaxed. Okay. Okay, last one. Last type of drug is hallucinogen. Hallucinogen. The example of the hallucinogen, marijuana, LSD, and ketamine. LSD is a lysergic acid diethylamide. It causes a hallucination. Hallucinogen cause a hallucination. It stimulate, it suppress, modulating the activity in the neurotransmitter in the brain. Okay, the effect of drugs and alcohol abuse. Okay, when you take excessive amount of drugs or alcohol, what will it cause? It cause liver cirrhosis. Why liver cirrhosis? The inflammation of the liver. Any drugs that you take or any alcohol that you take, or if you take alcohol or any drug, it will be filtered at the liver. If it's excess, too much, the liver receive too much drug, it cannot process anymore, it will cause the inflammation, and as a result, liver cirrhosis. It's very dangerous. Yeah, this liver cirrhosis condition, a chronic one, need the transplant, need to be removed. Okay, stomach ulcer. Okay, it also may inflame your stomach. The drug itself, usually drug and alcohol, the properties is acidic. Stomach already acidic, and your stomach already acidic. Then you take another drugs and alcohol altogether, it's extremely acidic. So it may cause inflammation at your stomach. It causes the hormonal imbalance and unclear speech. When you are hallucinating, you cannot think anything. Then you have an unclear speech. Slow reflex reaction. That's why a drunken people cannot drive. A drunk people tend to have a slow reaction. Okay, our reflex reaction when we're driving, we see something, an animal cross in front of the car, we directly press the brake, right? But for the persons under alcohol, their reflex reaction will become slow. Okay, they also will have a violent behavior because of the excessive activities of the neurotransmitter in their brain. They are hallucinated. They can't think what is right, what is wrong. Okay, now let's try to answer a question from paper 1. Let's try to apply a technique of GPS, guys. Okay, the following information shows the effect of a drug. The effect of drug. It causes hallucinations, affected muscle coordination, change the impulse pathway. What is the type of the drug? Type of the drug is the keyword. Okay, it causes hallucination. Anything that causes hallucination is either inhalant or hallucinogen. So depressant and the stimulant is the incorrect one. So the correct answer, either A or D. What do you think the correct answer? Inhalant or the hallucinogen? The correct answer, another keywords over here. Change the impulse pathway. Anything that changed the impulse pathway, modulated the impulse pathway is the drug in a group of hallucinogen. Okay. Okay, the next question. A man undergoes an operation to remove his pancreas. Okay, a man need to be removed a pancreas. Pancreas is one of the endocrine gland. What problem he will face? Okay, guys, if you can answer, please leave your answer in the chat box below so that we can discuss together. Either you get the correct one or incorrect one. Okay, we know that pancreas releases hormone called insulin. Insulin help to change glucose to glucagon. Okay, it not allow the amount of glucose in our body become excess. So that is the function of the insulin. Okay, what happen if someone don't have a pancreas already? So the pancreas cannot really secreted insulin. The body don't have the natural insulin already. So It have nothing to do with the high blood pressure. A is wrong. Remove pangkah, the incorrect answer. B, reduce body weight, also have nothing to do. So pangkah, remove the incorrect answer. Increase sugar level, yes. If your body don't have a pancreas anymore, then your body won't have a natural insulin. So the glucose won't be converted into the glucagon naturally. That's why your body have an excessive amount of sugar level. So C is the correct answer. Let's see D first. High rate of metabolism. Metabolism have something to do with the food that we eat. Okay, so the correct answer is C. Okay, we done with the paper 1. Let's try to answer section B. Section B. Section B, it's all about the theory and application. Okay, theory and application. Okay, let's see the sample question over here. Now, we have the endocrine glands in a woman. That means it must have an ovary. Okay, the one at the brain is a pituitary gland. Pituitary. And the one at the throat is called a thyroid gland at the neck. Okay, the one at the kidney is an adrenal gland. Adrenal gland releases adrenaline hormone. And is a pancreas. Okay. Okay, how about P? P is ovary. Okay, we are complete the label already. Now let's move to the question. Name gland O. What is O? O is an adrenal gland because it's located at the kidney, near the kidney. Okay, ask about O. How about B? State one effect to the woman. If both gland P, if ovary removed, what happened to the women if ovary was removed? So the woman cannot pregnant. The woman will have no menstrual cycle. The function of ovary is to release the ovum. If there is no ovum, there won't be a pregnancy. Okay, no, the woman cannot pregnant, the woman no menstrual cycle and become infertile. All right. Let's see the question C. Diagram 6.2 shows the effect of hormonal imbalance. A situation when someone has slightly bulging at the area of her neck. What is the problem? What is the disease? The disease is called a goiter. Goiter due to lack of iodine. It's all about a theory question, yeah, for this section B. Not much application I see yet. Okay. State the hormone. The hormone. State the hormone. What causes the hormonal imbalance? Thyroxine hormone. This one is a thyroid gland. Releases thyroxine hormone. This problem causes by the hormonal imbalance. Okay. How are hormone transported into the target cell? Still remember the story that I tell you? Okay, let's recap a little bit. Okay, a story where pancreas being releases insulin, then insulin will transfer into a bloodstream and then it will travel until it's meet their target cell. Okay, so how does hormone transfer in our body? Via human blood circulatory system. Okay, let's see question E. I think this must be an application question. A man experiencing a symptom always feel thirsty. Okay, these have something to do with diabetes insipidus. He also found his urine quantity to be excessive when urinating. Based on the situation, what hormone is out of balance in him? State the function of the hormone. Okay, the provided mark here is 2 marks. Okay, the first one you have to identify what type of hormone. What type of hormone that he lack of? ADH or antidiuretic hormone. 1 mark for a antidiuretic hormone for a correct hormone. Another 1 mark for the correct explanation, correct function. Okay, the function of antidiuretic control the quantity of water reabsorbed back by the kidney. Okay, this man having a excessive amount of urine because the amount of ADH secreted is insufficient, so that the kidney reabsorb only a little amount of water into the body. So that means he will urinate a lot. This is one of the symptom of diabetes insipidus. Yeah. Okay. Let's see the next question. Okay, also the same endocrine gland of a woman, but now it acts show at the adrenal gland. Adrenal. And why show the pancreas? Name gland Y in diagram 6.Y. Gland Y in diagram 6.1. Okay, gland Y is pancreas gland. Okay, number 2. What is the effect to that woman if gland Y to be removed totally from the body? Okay, let's say gland Y is removed from the body. The function of gland Y is to release the insulin. Insulin will convert the excess amount of sugar in our body into a glucagon so that the glucagon can be stored in the liver. Okay, so imagine that someone don't have the pancreas already. They won't have the insulin, right? They won't have the insulin. They won't have any insulin. So if they don't have any insulin, the blood sugar level in her body will be increases, okay, drastically, because they don't have insulin. So insulin is not there to convert any excessive amount of sugar in the body. Okay, let's move to the next question. Diagram 6.2 shows 3 adults, which are P, Q, and R. You can see that the adult over here, one very tall, and Q, normal. It's being stated that Q is a normal adult. Okay, this is a normal adult. And R is abnormal adult. Okay, observe diagram 6.2 and state the cause of differences in human body size and height. What caused the differences in terms of size? Okay, what caused someone growth? Growth hormone. It has something to do with the growth hormone, right? What gland releases the growth hormone? Pituitary gland. Okay, now they ask about what? The cause of the differences. Okay, the cause of the differences. For problem P, it happened because excessive amount of GH hormone. GH hormone. GH is the growth hormone. Please write a completely. Yeah. Okay. How about R? How about R? R, deficiency of growth hormone. Okay. Now we go to C. Ali came across a ferocious dog when he went out for a walk in a playground near his house. In a state of fear, Ali's gland X, what is gland X? Would secrete hormones that could help Ali to deal with the anxious situation. Okay. State 2, effect of the hormone secretion. Okay, first of all, we have to identify what is gland X. Okay, gland X, Ali went out and it made a very fierce dog and then he wanna run. Okay. So by this time, gland X play a role. Secrete a hormone. Okay, what is gland X? Gland X is adrenal gland. It will secrete an adrenaline. Okay, when the amount of adrenaline in the body increases, so the heart rate of the body will increase. The respiratory rate will be increased. What else will be increased? The amount of the blood supply to the muscle will be increased to prepare ourselves for the emergency situation. Okay, so they ask about the effect. I talked about the effect just now. You can write increase heart rate. Increase heart rate. What else? You can also write increase blood supply to muscle. Okay, supply to muscle. Okay, another effect. Increase rate of respiration. What else? Increase blood sugar level. Okay, we are done with section B. Now, let's go to the last section. Last question for today. We are about to finish. Just a little bit. Please bear with me. Okay, section C, a choices question. You may choose. It's either question 12 or question 13. You may choose. Okay. Diagram shows some examples of endocrine gland. The example of endocrine gland. Study the information in the diagram and develop a concept about endocrine gland. This is a conceptualized question. Okay, what is conceptualized question? Usually this type of question, they already give you with the information. They already provide the information. The information is there. Just need to transform in and get the 6 mark. Very easy this kind of question, yeah? Okay. What kind of information should you get? You see the pituitary gland, they give a pituitary gland. All of these, thyroid gland and the pancreas gland is the endocrine gland. Okay, just write the information. Okay, please make a box. Please make a table. Table comprises of information. 1 mark. 2 common characteristic. Please provide 2. At least can back up when one of the answer wrong. 2 common characteristic, initial concept, another example, not an example, actual concept. Okay, the information, they give you the gland already. So the pancreas, thyroid gland and the pituitary gland are endocrine gland. Okay, so just state what the question asks about and then 2 common characteristic. You have to think of what is the common characteristic of the endocrine gland. Both is being transferred in a blood circulatory system and both don't have a duct. Okay, do not have duct. it doesn't have, it secreted hormone directly into the bloodstream. Okay, and then the initial concept. How to write the initial concept? Put in the two common characteristic plus with the information, the initial concept. Okay, you have two common characteristic. The gland without duct and secreted the hormone directly into the bloodstream is the endocrine gland. Okay, so you get another 1 mark. So another example, give another example. We have a lot of the endocrine gland, ovary gland, testis gland. Just give another example, at least one example, and not an example. The one that not example is the salivary gland. We have a salivary gland, but not work as an endocrine gland. Okay, the actual concept. Finally, about the actual concept. You can write the information plus with the two common characteristic. Okay, it's relate with the initial concept. It's relate, yeah, relate to each other. Okay, now we are done. Okay, before I wrap up today's class, let's do some recap. Guys, if you have any question, please drop your question in the chat box, yeah, so that we can discuss together. We have a few minutes to discuss. Okay, since you guys don't have any question, let's just do a recap. Our body comprises of the human endocrine gland. We have a lot of endocrine gland. One of it is pituitary gland. We already learned pituitary gland. It secreted the growth hormone, GH hormone, and also ADH hormone. Growth hormone is control the growth of the person, and ADH control the reabsorption of reabsorption of water in kidney. And thyroid gland, it secreted thyroxine hormone that control the body metabolism. Metabolism have something to do with from the food, how it become an energy. Okay, then we do have the adrenal gland at our kidney. The function to prepare our body in emergency situation, it secreted the adrenaline. If adrenaline secreted, the rate of respiration will increases. The what else? The heart rate will also increases. Okay, we do have the pancreas that releases insulin. Let's say if someone don't have a pancreas, then they cannot have the natural insulin in their body, so that the blood sugar level in their body will become excess. Okay, for a women have an ovary. Ovary secreted progesterone and estrogen hormone. How about testes? For a man, secreted the testosterone. So testosterone hormone that control the sexual secondary characteristic of a male. Okay, how does the transfer of the hormone occur? Hormone being transferred in our whole body by the through the bloodstream, through to our blood circulatory system. Okay, how many types of drug do we have? We have the inhalant, and we do have an inhalant. We do have the stimulant. We do have the depressant and hallucinogen. Inhalant, usually the drug we inhale. Usually the drug used by inhalation. We inhale the drug. Remember the drug addict sniffing the glue. And stimulant. Stimulant is, you remember a situation of ADHD. Someone with ADHD, we need to increase the dopamine level in the brain so that we prescribe the one that have the ADHD with the stimulant, and then the depressant to slow the impulse reaction in our brain. And lastly, hallucinogen is a situation where there is a stimulation or suppression or modulation of the activities of the neurotransmission. Okay, we are done for today. We are done with unit 7. Okay, guys. Thank you for your attention. We'll be continue tomorrow in lesson 4, comprises of a topic from unit 8 until unit 10. Unit 8, 9, 10. So I'll be covering up 3 chapters tomorrow. So please bear with me tomorrow. See you tomorrow. Thank you for your attention and see you again. Assalamualaikum and a very good afternoon, everyone. Thank you.